Hi, I'm Dr. Christiane Northrup, an OBGYN physician and authority on everything that can go right with your body. I'm here to tell you how to transform your health and truly flourish while making your life much easier. Frozen shoulder is a very common occurrence in women between the ages of 40 and 60. The medical term for frozen shoulder is adhesive capsulitis. The symptoms include stiffness, pain, and limited range of motion in your shoulder. In the early stages, pain typically does not prevent you from reaching up. However, reaching backward, as if you were getting ready to throw a ball, tends to be painful. And this is why frozen shoulder is sometimes referred to as pitcher's arm. I've had frozen shoulders on and off for almost 5 years, and when my left shoulder started acting up to the point where I couldn't even put a jacket on, I regained my mobility through Pilates, yoga, massage, and ARP wave treatment, but also looking at my emotions. And then the right shoulder started to act up, and that also improved over time. And now I'm more flexible than ever before because actually my body was asking me to improve fascial patterns that had been a problem for years. So I want to share with you how to heal frozen shoulder. First, how do you know if you have frozen shoulder? It usually comes out of the blue. For me, it was picking up a piece of wood to put in the wood stove, and suddenly I fall to the floor with the pain. Like, really? There could be some underlying conditions, such as rheumatoid arthritis, diabetes, even sitting at a desk for long periods of time, hunching forward, can be a contributing factor. Tension gets stored in the shoulders and limits circulation. And then the cascade of chronic shoulder pain and loss of flexibility and range of motion leads to the shoulder stiffening and scar tissue developing. It's diagnosed by physical exam, although your doctor may order x-rays and an MRI. I didn't have any of these because I knew I didn't injure my shoulder or have anything wrong, though it sure felt like it. There are 4 stages of frozen shoulder. 1, inflammation, then freezing and stiffening, then frozen, you can't move it, and finally thawing. And the good news is it usually goes away on its own. Traditional approaches to treating frozen shoulder syndrome include combination of therapies, anti-inflammatory medications like Advil or pain patches, anything that lowers inflammation and relieves pain, steroid injections, and if anti-inflammatory medications don't work. Now remember, there's not a cure. Physical therapy can be very helpful. Ask what experience your therapist has with shoulder problems. Surgery should be a last resort, and it's often recommended when the shoulder is completely frozen. The standard protocol involves looking at the risks, looking at frozen shoulder as just a physical ailment and using traditional therapies, but that may not provide you with the relief you need. So now we come to the real issue, emotions and shoulder pain. The pain is whether in your shoulder or somewhere else, pain is a message. Something is not supporting you, or you're shouldering too many burdens. The emotional patterns of frozen shoulder are carrying the weight of the world on your shoulders, shouldering a burden that isn't yours, being too rigid in your thinking, too set in your ways, too much negative self-talk. By the way, 70% of our subconscious mind is negative self-talk. The location of pain can be a clue to what's not working in your life. Pain in your shoulder area is often about focusing on something that's not serving you. Pain toward the bottom edge of your scapula. You take on but don't release other people's problems. My problem was in the subscapularis. So, the side of your body where your shoulder pain resides is a clue. Pain on your left or problems with your left are usually from the past or the women in your life, because this is the mother, women in your life, the left side, the feminine side. Right shoulder has to do with a man in your life or the masculine aspects of your life. So, what's my advice for healing frozen shoulder? First, you make lifestyle changes. Lower the stuff in your diet that causes inflammation, mostly sugar. And then use supplements that help with inflammation. Turmeric, ginger, magnesium is really good for sore muscles. The antioxidant vitamins that attack free radicals. And then stretching. healing yoga asanas, restorative chest openers, shoulder shrugs. Breathe into the stretches, which helps remodel fascia. Don't slump forward over your computer. Move your arms and shoulders frequently and the rest of your body. Try gently pulling your shoulder blades down and back and squeeze them together. Get regular massage. Myofascial release helps, the work of John Barnes. Assisted release therapy helps. The GoClay method, goclaymethod.com, foundation training. I want to show you how to do that. Here's a shoulder roll that Esther GoClay teaches. And Esther is somebody who had an L5-S1 slip disc and required surgery, was told she couldn't have children again. She had the surgery, the pain came back, and then she traveled all over the world to find out why there's so many populations that use their bodies and bend every day and never have back pain. It has to do with how we use our bodies traditionally. Let me show you a shoulder adjustment that I've learned from the GoClay. So you move your shoulder forward, okay, and then up, and then back, 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 further than you would normally put it, and then let it hang there. And you'll notice that your shoulder is back in a different position and a more comfortable position. And then you just let it hang there. So do that regularly throughout the day. So you move your shoulder forward and then up, farther than you would normally put it, back farther than you normally would, and then boom, let it drop. Here's what people think when you say posture. We automatically do something you were taught in childhood that is wrong, okay? Which is this, okay? Chest up, shoulders back. What that does is it shortens your low back and increases the risk of back pain. Many times, the shoulder dysfunction comes from years and years of misalignment of the pelvis. By the way, the shoulders reflect the hips, and the hips reflect the shoulders. So when you've got something going on in your shoulders, chances are very good that the alignment is off in the hips, and you've got to work on the fascia. Now, you could try a TENS unit, transcutaneous electrical nerve stimulation. That often relieves pain. Try tapping, the emotional freedom technique. Here's what you do. Okay, tapping is this. You know, these are the karate points, like this. So you start with this. Even though I have pain in my shoulder, I love and accept myself right now. Then you go to the top of your head. Even though I have a frozen shoulder, I love and accept myself right now. Even though I have a pain in my shoulder, see, this is the inside of the eyebrow. Then the outside of the eyebrow. Even though I have this pain in my shoulder and I feel totally responsible for it, my pain in my shoulder, under your eye, pain in my shoulder, side of the nose, pain in my shoulder, upper lip, pain in my shoulder, I don't like it, I'm carrying too many burdens, under the lip, pain in my shoulder, side of the clavicle, bra strap. That's the emotional freedom technique. What have I just done? I have stimulated acupuncture points throughout my body that change the fascia. The fascia is a crystalline structure that holds your emotions, holds your entire history. It's like a crystalline grid in your body. So you do the emotional freedom technique. There's so many scripts on the internet. Just go to YouTube, emotional freedom technique, and do a script about your shoulder. Now, shift your perspective. Try gratitude. Go with the glass is half full. Try to release your anger. Stored anger can cause pain in any area of the body. Practice releasing anger while forgiving yourself. When you're angry, that's a little kid inside you that needs your attention. Acupuncture can be really helpful. Traditional Chinese medicine calls frozen shoulder 50-year shoulder because it's like reaches so many people at midlife. They call it wind-cold invasion with blood stasis, different terms than we use in medicine. Needles inserted into the trigger points and meridians can help, and this can help relieve some of the pain and immobility. Then, recite affirmations that Louise Hay has for shoulder problems. Here's a couple of them. I choose to allow all of my experiences to be joyous and loving. I am allowing love and joyous energy to flow through me freely. I release all the burdens that are not mine. Then try visualization. Imagine that the excess responsibilities just roll off your shoulders and you give them back to the people they belong to, or better yet, give them to the central sun. See them melting like butter in the Georgia sun. And then stand in the violet flame. This often releases things. Open your heart to receive love. Shoulders are part of your fourth chakra. This is giving, receiving. This is the heart meridian. And this can be blocked if we're not open to truly receiving love. So, to open your heart chakra and your shoulders, acknowledge that you are worthy of love. Even if you don't feel like you're worthy of love, just affirm it anyway. Envision love moving into the space between your shoulder blades, because also the heart is at the back of the body. Do this meditation throughout the day. I'm open to receive love. Another way to receive loving energy is to accept compliments. Someone says, I love your outfit. You say, thank you. I'll tell you what not to say. Don't say, oh yeah, I got it at Goodwill for $2. Because that's lowering the value you see. That's pushing love away. So someone gives you a compliment, you look nice today, I love your smile. Your job is to say, thank you. You don't even have to give a compliment back. Just let that in. Practice that. Okay. For more inspirational tips, visit my blog and explore drnorthrup.com, where you will find wisdom for your body, mind, and spirit, and discover the connection between your thoughts, beliefs, physical health, and life circumstances. There's far more than you can imagine. Remember, you're in the driver's seat of your health, not your doctor, and achieving your health can be easier than you think.